So the petition wants the jab to be given to under-11s. Is that what you want?
I think at meningitis now, what we're really keen is under-5s are the most at risk, and within that, the under-1s. Now, obviously, it was fantastic when we saw the introduction for babies last year. At the time, we were very keen to get this catch-up up to under-5s, and that's what we're looking for now, and hoping that we can have that discussion.
Because, as I understand it, Doctor, the next at-risk group after the under-5s is 16 to 20-year-olds, not the under-11s.
Yes, you have to remember that the vaccine, the decision to introduce the vaccine was only made in March last year, and the first infant was immunized within 6 months. That program was introduced very quickly, and therefore it was important to target the group with the highest risk of disease and the ones who have the highest fatality from the infection. So this is a new vaccine. The UK is the first country to introduce a vaccine. We need to monitor the vaccine and collect more information before we can implement it more widely.
If it is implemented more widely in response to this petition or anything else, is it affordable? Is it doable?
So all vaccine programs are very expensive. The NHS is very unique in that the vaccines are provided free of charge for every single child in the UK. We're talking about 700 infants every year. It is a very expensive program, and it's important that we make the right decisions to make sure we use our resources correctly to target those who are most likely to benefit from the vaccine.
Because, Sue, with people signing this petition in such great numbers, clearly there's a lot of good feeling towards doing something about this, but there is a little bit of misinformation out there, a bit of misunderstanding as well.
I think one of the incredibly positive things that's come out of this, and obviously our thoughts are with Faye's family and all the other families that have lost loved ones, is this whole discussion has raised so much awareness of meningitis, and that in itself is going to save lives.
But is there a problem that then people just jump on what is a bandwagon and you lose perspective on meningitis B, which is a fairly unusual illness?
Yeah, we have to be really careful. This is a rare disease. Men B is just one of the types of bugs that can cause meningitis. There are others. And what we say to anybody is they've got to stay vigilant no matter what. This is a huge step forward last year when we saw it introduced. But we do have to collect information. I think what we're saying at Meningitis Now is we were trying to campaign to get the up to 5s done right at the beginning, and that's what we're now talking about again. But I think we have to make sure people keep it in perspective. This is a rare disease, but stay vigilant. Make sure you know the signs and symptoms.
Just remind us what those signs and symptoms are, because quick action is key, isn't it?
Yeah, so the meningococcal bacteria can cause 2 very nasty illnesses. So they can cause meningitis, which is an infection of the brain, and they can cause septicemia, which is blood poisoning. And really, any child who looks sicker than they should be with any illness and having a fever should be seen by a healthcare professional. So things like headaches, bright lights bothering them, neck pain are signs of meningitis and need to be managed promptly.
But in your expertise as an immunologist, how important do you think it is to get this programme rolled out, or are there other things that are more pressing, other illnesses?
So meningococcal disease remains one of the most feared infections, not only for parents, but also for doctors, because it starts very suddenly and then it progresses very, very rapidly. This vaccine that we're talking about has taken 20 years to develop. It is a vaccine like no other vaccine in the program. We hope that it will save many, many lives. But before we can recommend its use widely, we need to make sure that it is safe and effective and we target the right age group.